Go.
Priscilla Hopkins.
You were then referred to your pulmonologist, and he performed an endobronchial ultrasound back in March, with that pathology showing a lung cancer, specifically non-small cell lung cancer adenocarcinoma, which is the most common subtype.
That's right. And then he performed a PET-CT.
And how did that go?
Overall, better than I expected. I really didn't have much pain afterwards, and I was able to be discharged after just a few days. And I've hardly had to take any pain medication.
And you've been doing well since then?
Oh yes, I was back to eating pretty well and breathing normally and with my regular activities within a couple of days of going home. I'm really feeling pretty normal at this point and have been for a couple of weeks.
The question we need to consider is whether any further treatment would significantly reduce that risk and whether it is worth pursuing it.
I've had several friends who have had chemotherapy and they had a difficult time. I'm also concerned about my heart disease and history of kidney problems. Makes me wonder whether I could really tolerate chemotherapy well.
You certainly have fair concerns. The key is that the chemotherapy is very helpful for a small minority of patients, but we can't identify which patients are going to be the ones who would benefit most.
It doesn't sound especially promising to me. Would my risk be higher because of my age and other medical problems?
And with your other medical problems, that likely means that your risk of problems from chemotherapy are a little greater than those in a so-called average patient, if there is such a thing.
Can I talk about it with my family?
We'll need to do a biopsy to confirm it, but I'm concerned that this looks very much like the cancer has returned and spread.
I knew something wasn't right. My energy was way down, and I would sleep all the time if my husband would let me. I've also lost about 5 pounds since the last month. I just didn't have my usual appetite. But I really want to discuss further whether I should get treatment or not. I'm still concerned about the side effects. I don't want to feel sick all the time. But if I could keep the cancer with minimal side effects, I'd be interested.
The goal would be to have a little longer, commonly several months, but sometimes even years.
And how much would this help me? I might live a couple of months longer.
We can then decide whether it's helping enough when weighed against the side effects.
Well, that sounds good. Can I bring my husband to discuss the details with us at the next visit?